global optometric education, challenges, and also the improvements, the students' perspective. And I'll be starting off with an introduction. Firstly, my name is Aloze Samson, and I'm the National President, Nigerian Optometric Students Association. And I will be moderating today's section, and I'll not be doing it alone. I also have my co-moderator, and I'll be giving her the platform to also introduce herself. So, Blessing, over to you.
Thank you so much, Samson. My name is Atta Blessing Margaret. I'm from Makerere University. I'm an optometry student, and I'll be hosting this session with Samson. We are so glad to have you around. This is not just an online meeting, it's a conversation. Feel free to interact. We have very many speakers on the line. We hope that you will learn something. We thank everyone who has set time apart to attend this session. We are so happy to have you. And yeah, we shall have a question and answer session, or make use of the chat if you do not understand something. Yeah, we shall be able to learn. We shall be able to understand each and everything. I'm so happy. I'm so excited to be hosting. This is day 4. We've had 3 awesome days with other continents. Today we have Africa, we have Europe, we have Australia. We are so happy to have each one of you here, and you can register in the chat for the certificates that will be given out. They've sent the format, how you're supposed to register in the chat. Please make time, register, and I wish you good luck. I wish you good luck, and let's have very learning session. Thank you so much. Over to you, Samson.
Thank you very much. Thank you very much for that, Blessing. So, like she rightly said, this is a platform, or this is a section where we tend to learn, and not just learn, but learn globally to understand what is happening in different regions and also learn how we can tackle these problems. So, without further ado, I would like to introduce Dr. Jennifer Vinola for the opening remarks on behalf of the Manila Central University College of Optometry. So she'll be giving us an opening remark. So and Jennifer Vinola, over to you. The platform is yours. Thank you very much, ma'am.
Thank you, Samson. So good day, everyone. Or it's actually a good morning here in the Philippines. So it is with great honor and sincere excitement that I welcome you all to day 4 of our global summit hosted under the name Lens of Diversity, Global Optometric Education, Challenges and Improvements, the Student's Perspective. On behalf of SVOSH MCU chapter and OptoGlobe, I extend a warm welcome to all our esteemed speakers, students, faculty members, and distinguished guests from Africa, Europe, and Australian regions. This summit is more than just a meeting of minds. It is a vibrant gathering of voices, cultures, and ideas united by one shared vision: the betterment of global optometric education. We are proud to provide this platform where students are not just participants, but are empowered as leaders, advocates, and future change makers. As representatives of SVOSH MCU, we are deeply committed to the values of service, collaboration, and global learning. And through OptoGlobe, we continue to strengthen regional and international ties, recognizing that eye care is a universal right and education is the bridge that brings quality care to every community. Throughout today's session, you'll hear from passionate student presenters and leaders who will explore the challenges they face, the innovations they envision, and the opportunities we must collectively create. This is a time not only to listen, but to connect, reflect, and contribute. Let us make the most of this time together, not just as members of our respective institutions or countries, but as one global optometric community working towards shared progress. Thank you for being here, and may today's session inspire continued collaboration and meaningful action. Thank you again.
Thank you so much. Thank you so much, Dr. Jane. Thank you so much for welcoming us to this session. We are honored to have you, and thank you for making us feel at home. We are so happy, and thank you for the welcoming remarks. And on to, and
I
the
feel
next,
you. I feel
Please go on,
uh,
Blessing.
I I think someone was having a technical issue. Thank you so much, Dr. Jen. And the next, we shall have remarks from our OptoGlobe regional. We shall have the OptoGlobe regional address, and we shall have it from Dr. Luke and Don Mark. They'll be addressing us on the affairs of the OptoGlobe on our region. As we know, this session is Africa, Europe, and Australia. So we shall have the remarks from the OptoGlobe regional advisors, and they will tell us on the benefits of being an OptoGlobe member and everything OptoGlobe. So, ladies and gentlemen, join me and we welcome Luke and Donma. Thank you.
Hello everyone. I hope I can be heard.
Yes.
Yeah, we are hearing.
Yes, you can.
All right, okay. Sure. Thank you. Good evening to you all, to our distinguished guests, speakers, and then our colleague optometry students here. So it's an honor to welcome you all to the second World Summit of OptoGlobe, a global community of optometry students that is dedicated to empowering our members to connect, learn, and advance eye care together. As the regional director for Africa, I am delighted to see our presence in this continent grow stronger with each passing day. As we gather here today, I am really excited to note that OptoGlobe has gained recognition in at least 15 African countries, with participants from Nigeria, Ghana, Cameroon, Uganda, Kenya, Somalia, Mozambique, Ethiopia, Rwanda, Congo, Morocco, Sudan, Malawi, and Egypt registering for this summit. This milestone is a testament to the impact and reach of our organization in Africa. Our presence in Africa is not just about numbers, it is about the collective passion and commitment of our members to advancing eye care and optometric education. As we look to the future, we are excited to build this momentum by establishing a committee comprising ambassadors from each African country. This initiative will enable us to amplify our voices and establish greater collaboration to drive meaningful initiatives that benefit our members and broader optometry community. The theme of our summit this year is Lens of Diversity, Global Optometric Education Challenges and Improvements, the Student's Perspective. This resonates deeply with our African chapter as we navigate the complexities and differences of optometric education and practice in our diverse contexts. We recognize the importance of sharing knowledge, experiences, and best practices. I would like to express my gratitude to our members, to our organizers, and in fact to our CEO, Pemije, for his tireless effort, and to all the organizers. Thank you so much for working so hard to make this a reality. As we embark on this chapter in our journey, I look forward to working together to create a brighter future for optometry in Africa and the world at large. Thank you very much for having me.
Thank you very much, Mark. Thank you very much, Mark. It's actually a wonderful thing that OptoGlobe is actually standing to its name, or yeah, standing to its name is a really great thing, and I'm really proud to be. I'm really glad to be part of this movement. Like he rightly said, this is the second World Summit, and if you missed the first, I think this is another time to cover up. And I really want to appreciate everyone that is present on this section. It's a really great thing that you're part of this. So there are a lot of benefits from our speakers, and there are a lot of things to learn from the speakers. So get your notepad, get your notebooks, get your jotter, get your pen to pen down something because we're going to learn a lot. So without further ado, I'll be calling on the first speaker. He's going to share his video with us. But before then, I'm going to talk about a little bit about the first speaker. So for our first speaker, we have the person of Professor Peter Hendecourt, a globally respected optometrist educator and policy leader with over 5 decades of impact. A graduate of the Queensland Institute of Technology, he began his career in Brisbane before pioneering optometry program across Hong Kong, New Zealand, Ireland, and Australia. He has held major roles, including senior lecturer at Hong Kong Polytechnic, head of department at Dublin Institute of Technology, and head of school at Queensland University of Technology. He has served as chair of the Optometry Council of Australia and New Zealand and led key organizations such as the Asia Pacific Council of Optometry and the Optometrists Association of Australia, Queensland. From 2021 to 2023, he served as the president of the World Council of Optometry and continued to serve as immediate past president and board members. Known for his dedication to advancing clinical education and global standard, he was honored as the KB Wu Memorial Lecturer and Queensland Optometrist of the Year in 2001. So his video is going to be displayed, so please sit tight and actually learn from it. Don't forget to jot down something. And if there are any questions, please, you can just pen down your questions during the question and answer sections. Your questions will be attended to. Thank you very much.
Hello, I'm Associate Professor Peter Hendecourt, the immediate past president of the World Council of Optometry, and I'd like to thank you for this invite to talk to the OptoGlobe Student Conference. I'm very grateful for the chance to speak to you all about this topic. I'll just share my screen. What I'd like to talk to you about is how I see optometry's future roles in eye care. There are a number of things in the background. So to set the scene initially, this is WCO's long-standing concept of optometry, which talks about optometry being an autonomous and regulated profession that's a primary healthcare profession related to the eye and visual system, where we provide comprehensive eye and vision care, and that includes, of course, refraction and dispensing, but importantly, the detection and diagnosis and management of disease of the eye and rehabilitation of conditions of the visual system, and where optometry has, at a minimum, a battery level degree or its equivalent from a tertiary educational institution. And importantly, where the outcomes of that education are aligned with those of the WCO Competency Framework for Optometry, which was released in May last year. This definition is older than that, but we've updated it to make sure it aligns with the newly released Competency Framework for Optometry. But importantly for us, for optometry, while that sets a marker as to who we are and what we are, we have some backup because the WHO released in 2022 a document called the Eye Care Competency Framework, which, if you're not familiar with, it's worth looking at because it describes optometry in a particular way and in a particular position within the spectrum of professionals that provide eye care, who can range from community level eye care workers through to ophthalmology. But importantly for us, it describes our role in a particular way. And initially in this document, it references eye care professionals related to the extent and the depth of their training. And the red box on the right-hand side of the table, extracted from the document, shows this. Inside that red box is where optometry fits, where we have an advanced level of higher education, again, a degree, depending on how the nomenclature in your particular countries, and where we as professionals may specialise and have teaching and research roles as well as clinical roles. But importantly, it describes us as autonomous practitioners, as does our WCO definition, of course, and where we provide, and their wording about what optometrists do is basically similar to that of the pre-existing WCO definition of optometry. And importantly, it talks about our scope, managing vision disorders and eye conditions rehabilitation. And for some of us, depending on where we practice, we may have rights to prescribe medications to treat a range of eye diseases, and in the USA particularly, and a couple other countries less so, some ability to undertake minor surgical procedures as well. YAG lasers, for example, for capsulotomy would be one example of that, which in certain states of the USA. So that's an important document. As you can see, we're listed in the same category in the similar range of scopes to ophthalmology and optometry at the upper end of the spectrum of professions that you can see there that relate to providing eye care. So the WHO's push is not so much what your title is, but what you can do, what skills and competencies you have. And that's an important thing to remember when we're looking at where optometry has to fit within a future health system. It's not what we're called, but what we can do. And perhaps what preceded the WHO's eye care framework document, competency framework document, is this report, the World Report on Vision, which many of you would be well aware of. And it talks about the growing burden of visual loss, refractive error, ocular disease, and so on, that the world will be facing. And importantly for us as optometrists, it sets out what some of the challenges are and where eye care might have to develop to resolve these unmet burdens. And it's important for us to remember that the number of people who experience vision loss worldwide predominantly are in low to middle income countries. Most are over 50, and more than half, 55%, are women. And the WHO's World Report on Vision talks about the inequities that exist in people's ability to access vision care. And we know that's the case. And that vision loss that's preventable is greater where there's social and economic disadvantage in rural areas, in older people, in ethnic minorities and Indigenous peoples, and as I just said, women. So both this and the eye care competency framework are readily available from the WHO's website. And importantly for optometry, the United Nations General Assembly in July 2021, in this agenda item, called on UN member states to ensure access to eye care services for their population and to mobilise resources and support to ensure that people who do not have access to eye care services, that their access is generated. And there's definitely, as we all know, a role for optometry to play in that agenda. But if we're thinking of the future, we need to think about where we are at the moment. And if we think about optometry, and you'll have this experience because you're an international grouping of optometry students and you'll have different educational backgrounds. So where optometry is, it varies across the world in terms of how it's educated. And the WCO's competency framework is a first step in making sure that we set a minimum marker for what we should expect from optometry students when they graduate. So not to say we all have to be taught the same, but we all have to be in the same way, but we all have to be taught and learn to do the same things by the time we finish our programs. So our education varies. Our legislation and our regulation of optometry varies. In some parts of the world, optometrists, whilst they may be university level educated, are prohibited from doing certain things. For example, they can't use slit lamps or retinoscopes in some countries. They can't prescribe for children in some countries. They can't use diagnostic drugs in some countries, etc., etc. In some countries, optometry is not recognised, and the delivery of eye care by those who call themselves optometrists is not regulated. And we have to remember that licensing and regulation is not there to protect optometry, but it's there to protect the public from people who don't have the appropriate education and competencies. And we vary, of course, because of scope of practice. There are only a handful of countries where optometrists have the right to prescribe medications to treat eye disease. One issue we have to face as a profession is that in many of our countries, we have more than one group of people who call themselves an optometry association. They claim, who say they represent people who practice optometry. So where there are multiple groups, there are often conflicting agendas. And that's a problem in trying to progress professional recognition and expansion of scope of practice. If agendas conflict, we won't get anywhere. And we have to think about the other groups that are involved in eye care. And we have to think, is what we consider as optometry's traditional space, which has been grounding in refraction and dispensing, that's being eroded from below by people who are being trained to refract as technicians and so on. At the same time, though, we have to remember we're trying to erode at the top end and gain greater rights in eye care and prescribing and minor surgery and so on and so on. So we're going to have increasing difficulty in arguing that something is just only something that optometrists can do, because it's quite apparent. If you look at the WHO's competency framework, that they're talking about skills that overlap between groups. So we have to think about what's unique to optometry and what skill set do we bring that others don't bring. And that's, of course, the clinical and diagnostic thinking and integrated thinking and management and so on. So, but what we really need to think about is not where we are, but where do we want to be? What do we want our future profession to look like? And that's what you need to be thinking about, because you, of course, are the future profession. So we have to, so what are our challenges we have to recognize and that we have to look at? And we all know we have an issue around the number and distribution of eye care professionals, not just optometry, but ophthalmology and others. We have a growing and aging population. And that, of course, we have an epidemic, if you like, or a pandemic of myopia development. And we have a growing number of people who will be presbyopic. We have a growing number of people across the world who will have glaucoma, and importantly, undiagnosed glaucoma, and diabetes, and a range of other conditions that threaten ocular morbidity, and threaten vision. And there are a growing number of people with non-sight threatening conditions like dry eye, for example, all of whom are going to need access to eye care, some of whom will need ophthalmology care, some of them with these conditions like myopia, glaucoma and diabetes don't necessarily need ophthalmology care, and they can be handled by optometry in a community setting. We have to think about our optometry education and how it's resourced, what the curriculum and outcomes are, how it's staffed, and how it's developed. We have to think about how we, if we're looking at improving optometry's role in healthcare systems and making ourselves fit for future roles, we have to think about the existing practitioners and how we support them as well. It's not just graduating new optometrists with a new set of skills, it's how we can give those skills to our current practitioners so they don't feel left out and left behind. And we have to think about how we can support practitioners in changing or expanded roles or scope and how that's recognized within the healthcare system. So just to illustrate, this comes from a paper published in 2021 based on an earlier epidemiological projection of the number of people with glaucoma in 2014. And we can see this compares the number of people with known glaucoma, primary open angle, in different regions of the world in 2020, and the number of people estimated to have undetected glaucoma, primary open angle. And in 15 years' time, 2040, the number of people who will have open angle glaucoma and the number of people with undetected open angle glaucoma. And you can see, particularly in Asia and Africa, predominantly, a 50% increase in both the number of people with glaucoma and the number of people who aren't aware that they have glaucoma. And that's a challenge for the eye care system. That cannot be handled by ophthalmology in hospitals. It has to be handled by optometrists and others in community level practice. And this is where we need to be thinking about how we position ourselves to contribute to these challenges. And that's just but one example. So we have our challenge is to make sure that optometry has the relevant competencies, the outcomes of education, the behaviors, the things that we can do that will enable us to broaden our scope to participate more fully in healthcare delivery. And as I just said, that's particularly in ocular disease and the clinical and management skills that go with that, because that's the component that's lacking in optometry in many, many parts of the world. We need to make sure we develop those skills, because that's where the growing need is going to be. But importantly, we have to show that our education is robust, that it's strong, and we can evidence that it gives us the competencies. And we have to demonstrate that when optometrists do maintain patient safety when they work. When we look at growing the profession and advocating for increased scope, the one issue that comes back against optometry every time is that patients will be unsafe if you allow optometrists to do these things, use diagnostics as it used to be 30 years ago. And we went through this argument in Australia in the 1970s and 80s. The same argument about therapeutics. We have to evidence that when we do our work and when we play these roles in health systems and we play these roles with detection and diagnosis and management of ocular disease, that we are safe and that patients are safe in our hands. So we need an evidence-based for change roles and an increased scope of practice. And some of that exists. There are examples of that across the world, but there may need to be that evidence base on a local level within particular countries, as well as the international evidence base. So we need to think about how we as a profession develop that and maintain that. So what education do we need? And this is the WCO competency framework for optometry. I apologize that my image is covering the picture, but we had set a set of competencies and skills and behaviors, as I said, in refractive error management, and that's our core history. But importantly, in ocular health and ocular disease and assessment and management of that, other visual functions, binocular vision and so on, remembering that in clinical populations under 30 or 35, depending on what binocular vision disorders you look for, up to 30% of people in population screenings have binocular vision disorders that many of us conveniently ignore in our clinical practices. We need public health competencies, an understanding of why people get ocular problems, the societal factors that influence health and so on, and the competencies expected of a health professional, ethics and morals and legal practice and so on. So our document, the framework for optometry, has defined these outcome statements. We're saying that we expect, as a professional organisation that represents optometrists worldwide, that optometric education leads to certain outcomes. We're not saying you have to teach things in a particular way. We're saying however you structure your optometry program and however you teach it and however you assess it, that it should lead to these outcomes. Because it's important to say what the outcomes of optometric education are in terms that are relevant to people outside the profession, what you can do. Because as you well know, all your courses that you are sitting currently in are not taught the same way. They're not assessed the same way, but they should be leading to a set of outcomes that are universally the same. And that's what we set down as the minimum. And there's a companion document to this that's about to be released talking about the transition to therapeutic practice. We also need an evaluation of how effective our optometry training programs are, which is a system of accreditation or program review that's external based and internationally benchmarked, which is able to demonstrate to our lawmakers that optometric education is robust. And we need to think about CPE or continuing education or credentialing even for current practitioners so they can evidence that they've also gained these skills in postgraduate or future education they didn't have when they were initially first trained. So we need to advocate for recognition of optometry as an autonomous profession, one that is self-governing, makes its own decisions, independent of others. We need to advocate for legislation of who can practice optometry. as a public safety issue, because legislation is there to protect the public, not to protect the profession, as I said earlier. We need to make sure that our scope, that if there is to be a legislated scope of practice, it's commensurate with the level of education. It's better to say you can, whatever you are educated to do, you can practice. Because if you prescribe procedures in your legislation, as the profession grows and knowledge changes, you will then have to change, and education changes as a result. You then have to go back and change your legal definitions of scopes. It's better this. It's much easier to say that however you are educated and what you are educated to do is what you should be able to practice. But we also need legislation that permits access to the diagnostic and management tools that we have to use to address future care needs. As I said, some countries don't have access to drugs. Some countries prohibit optometrists from doing certain clinical procedures. We need to identify what role we can play in a particular country's health system. How optometry is practiced in Australia, my country, or in the US may not be the model of optometry that works best in your particular country's health system. But as I said before, if you've got multiple groups that represent the profession, as a professional organization and the educators all have to have common objectives when you approach government. Going to the government as independent organizations that don't agree will get no result, because the government will say, go away and agree first and then come back to us. We need to identify how optometry will benefit both the system and the population. And I mentioned about patient safety before, and an evidence base that supports those roles. We need to start thinking outside the box a little about what our modes of practice are. Are our current modes of practice, where we practice largely as a siloed health professional in a community practice, are they the most appropriate roles for the future? Or do we need to start thinking about how we interface with other professionals in healthcare who can deliver some components of eye care and other components, how we interface with other health professionals? So we need to think, do you need, as the clinician, the optometrist who makes clinical decisions, need to be the one that collects all the data that you need to make those clinical decisions? Can you have that supported by other people and use your unique part of your skill set that others don't have, which is how to pull that information together and link it with their other healthcare needs? Do we talk to pharmacists? Do we talk to rehabilitation professionals before we make decisions, or while we make decisions about patients, for example? We need to think about, we've got a growing, all the documents, all the research, publications in the Lancet Global Health, the World Report on Vision, all talk about increasing needs for eye care. Is the solution to that training more eye care practitioners? Just think about it. How long is your optometric training? In some countries, that's 7 years, an undergraduate program of 3 years and a 4-year optometry program. And it graduates 50 to 100 people per year. If we need 50,000 more optometrists, that's a 20 to 30-year plan. It won't meet the immediate needs. So we need to think about how we can work smarter and more efficiently and effectively. And that is working with others. How can optometry take a leading role in partnerships that develop sustainable pathways in countries where eye care pathways currently do not exist, working with people who work in the community, with optometry, and with the secondary system in hospitals? Where can optometry fit within all those pathways? And where can optometry lead and develop those pathways as much as delivering clinical care? We need to think about the impact of current and future technology on the delivery of eye care. How can tools such as AI-led diagnostic tools, the ones that look at retinopathy, the ones that look at vascular disease from retinal vasculature patterns, and the diagnostic technology that sits behind OCT and determining a progression, all those things, remote care delivery, teleoptometry, and so on and so on. How can those tools be utilized by optometry to improve equity and access and outcomes for people? So our challenge is to advocate for the skills and competencies of optometry to be wider utilised within healthcare systems. And there's lots of evidence, as I said before, that supports an increased primary care role for optometry. There are examples from the US and the UK and Australia and Canada, South Australia, South Africa rather, and a range of other places that show improved outcomes for patients through early detection of conditions that have ocular morbidity or threatened vision, so glaucoma, diabetes, ARM, all those things. And how involvement of optometry improves early detection and the patients are not in the secondary healthcare system of hospitals, but they're dealt with in community. So we have international evidence. You may need that in localized settings. And an increased primary healthcare role for optometry, of course, reduces, if we are trained appropriately and have the right set of skills, reduces unnecessary referrals to ophthalmology at the secondary and tertiary care levels, which makes for a more cost-effective healthcare system, and a healthcare system provides better outcomes for people. So as the last point, dot says, optometry in collaborative care and shared care schemes is cost-effective, and a cost-effective way to increase the provision and effectiveness of eye care. So this slide says the optometry's future, the changing world. So we have to think, if we look at the challenges set out in the World Report on Vision, it's and future publications in the Lancet Global Health type document, or a journal, if you like. Future vision and eye care needs all eye care practitioners. So I'm talking of the spectrum of people from community level health workers in rural and remote settings, through to optical technicians and refracting technicians and orthoptists and dispensers and so on, optometrists and ophthalmologists. It needs all of us to be able to work at our maximum scope of practice. We have to recognize as a health profession that other people can do part of what we can do. No one else can do all of what we can do. And our colleagues in ophthalmology need to recognize that we can do part of what they can do. So, people need to be using their highest level skills for most of the time, and allowing people who can do the lower level skills, data collection, for example, to do that to support our role as clinical decision makers and clinical deliverers. We need to plan for multidisciplinary team-based approaches for that continuum of eye care across the health system. And as I said earlier, we need to look at how we can play leadership and decision-making roles in the development of that process, in its ongoing management and its ongoing quality audit. So, we can't do this at a global level as one organization. We need to think about how it would work within each country. And that's your role as future practitioners in your own country and your professional and representative associations. How can you work out and how can you recognize and react to your country's individual challenges? The World Council of Optometry is there to help that happen. And we have a lot of resources that people can draw on and we can support arguments for increased scope, for legislation and the like. But we need to start thinking about what's happening with eye health, visual healthcare, eye care in our own country. How can we improve it? What's the best role optometry can play in improving that role? And thinking about 10 or 15 years down the track, because we may have to educate differently, and that takes time. We need to bring our existing practitioners on board. You as future optometrists may have great ideas about how the profession can advance and what it can do in your home country, what it can do internationally, but you have to bring the existing practitioners on board and say, look, we want to go here and we can bring you with us. If we help you and we teach you, improve your education and improve your skills and therefore improve your role. So it needs to be a combined and collaborative effort across the spectrum of professionals in a country. And the key for us to think about is we can increase access to and the affordability of care. We can reduce inequity in access. We can work in multiple health settings, community practices, community health centers, hospitals, secondary and tertiary hospitals. We can design and lead team-based care. And we have to argue for primary eye care delivery in community settings, as opposed to secondary hospital settings, which is the situation in many countries. Doing the primary care delivery in the community is much more efficient. It's lower cost, provides early detection, can provide ongoing management and review, and only the people who need to be in the secondary settings are sent to the secondary settings. But of course, optometry can work in those higher settings as well. So a number of things to think about going forwards. So thank you for listening. I wish you all the best in your future careers in optometry, and thank you for listening to me. Bye.
What a powerful message from Professor Peter. He is the immediate past president of World Council of Optometry. So this was quite a lot to learn, where optometry has come from, where optometry is, where optometry looks to be, how it can fit in the future health system. This was a lot. I hope we learned a lot from this session. Remember, if you have anything to ask, anything you want to ask, anything you want to expound more about, you can type in the chat and we shall get those questions and we shall have a Q&A session later during this interaction. So next we shall have the optometry regional, the OPTOGLOBE regional director for Australia, and that's Dr. Luke Quadros. We shall receive his video, and yeah, I hope we learn a lot from him too. Thank you.
Good evening, everyone. Thank you so much for being here with us at the OptoGlobe Summit this year, the lens of diversity. My name is Luke Quadros, and I am the Regional Director of OptoGlobe here in Australia, and I am a final year optometry student at Flinders University in Adelaide, South Australia. I've been part of OptoGlobe now since its founding, and it is an incredibly supportive family with board members who are truly passionate. And of course, none of it would be possible without all of you student members who inspire me and all of us every single day. Special thanks to Pemajay, our founder, for having me here. And once again, thank you for all of your hard work and dedication as always. So today I'm here to tell you a little bit about OptoGlobe and my personal journey from my perspective over here in Australia. So I just want to start by taking you back to the beginning of my very own optometry journey. Like many students, I struggled in those early years. I remember sitting in anatomy lectures overwhelmed by all of the Latin terms and cross sections of the orbit, wondering if I was cut out for the profession. And with things like optics, let's just say all those ray diagrams and formulas did not come easy for someone like me with no physics experience in high school. What made it harder for me was that I didn't have a clear sense of what the student experience could be. I didn't know how other students around the world were learning or coping or even thriving. I was siloed, like many of us are, confined to my lectures, my cohorts, and my little corner of Australia. And that changed when OptoGlobe launched during my 4th year. And I was so lucky to join as part of the team to grow OptoGlobe to where it is now. Suddenly, I wasn't just a student at Flinders. I was a student in a global optometry network, connected to my peers in Nigeria, in Europe, in America, in the Middle East, just to name a few. I saw how others were learning and innovating, adapting. I listened to their challenges and I learned from their experiences. For the first time, I understood how powerful it was to be part of something bigger. And that's why this summit, the lens of diversity, is so important, because our strength as a global profession comes from our differences, different teaching methods, different patient populations, different scopes of practice. When we come together, we don't just share knowledge, we challenge assumptions, we expand horizons, we grow. Now, let me speak directly to my fellow Australian optometry students. Australia may be small in population, but our voice in optometry is strong. We are very fortunate. We practice at a high clinical level. We prescribe topical medications. We manage things like glaucoma and control myopia. We perform foreign body removals, and this is just the tip of the iceberg, really. We are the primary eye care providers and the front line against both avoidable and unavoidable blindness. But here's the truth. If we want to lead, we must also learn. And learning cannot stop at our borders. A few months ago, I had the opportunity to take part in a 6-week placement at the Christian Medical College Shell Eye Hospital in Vellore in India. And this was alongside 3 other Flinders students and 6 students from the University of Melbourne. And it was honestly one of the most transformative experiences of my life. Every day we were seeing advanced pathology, often at a volume and a variety not typically encountered in Australian clinics. We learned techniques that weren't even a part of our curriculum back at home. And more importantly, we learned how to be adaptable, resourceful, and culturally sensitive. We were growing, not just as clinicians, but as humans. Now, not everyone can hop on a plane and do a placement overseas, and I understand this, but that's where OptoGlobe steps in. It gives you access to that global perspective right from your phone or laptop. One conversation in the OptoGlobe community can expose you to a whole new way of thinking about a case, a patient, or a clinical skill. And this isn't just about sharing information, it's about building bridges. Let me give you a simple example. Picture 2 students, one in Adelaide, one in Benin. Both of them are fascinated by, let's say, diabetic retinopathy, and both want to pursue research, but lack the resources or patient base to do it alone. Through OptoGlobe, they connect, they collaborate, they support each other, and now they are not just students with an interest, they are international researchers, backed by 2 universities and a community that believes in them. That's just one example of the kind of future OptoGlobe is trying to create. And we're just getting started, really. So yes, there are tangible benefits. You have the educational resources curated to support your academic development, networking opportunities with mentors and students worldwide, career guidance through internships, job postings, and mentorship programs, and global events like this summit that unite us across time zones and borders. But I want you to see it for what it really is. OptoGlobe is not just a platform. It's a movement, a community, a place where your voice matters. Whether you're a first-year student trying to understand refraction or a graduate thinking about subspecialty pathways, it's a place where you're seen, heard, and supported, no matter where you are in the world. When we graduate, we'll be stepping into a profession where we are truly privileged, because we hold the power to change lives every single day. Every time we ask one or two, we're not just refining a prescription. We are helping someone to see their world more clearly every single day. Every fundus we examine, we're not just ticking a box, we're on the lookout for sight-threatening pathology. And with every patient we meet, we are not just providing a service, we are building trust, offering support, and delivering care that can profoundly impact someone's life. So let's not lose sight of what drew us here in the first place, the desire to make people's lives better, one patient at a time. OptoGlobe gives us the tools to do that, not just locally, but globally, to learn from one another, to uplift one another, and to redefine the future of optometry and what it can look like together. So I will leave you with this. Join us. Be part of this, not because it looks good on a resume, but because it will change how you see the profession and how you see yourself within it. Thank you very much for listening to my talk. I'm very sorry I could not be there with you today, but I hope that all of you who are watching and listening have enjoyed the summit so far and will enjoy the rest of it. Thank you very much once again.
Thank you very much once again. Thank you very much once again, Luke Quadros, for that eye-opening speech. Luke Quadros is actually the OptoGlobe Regional Director for Australia, and he has given us a very, very insightful speech. Now, this is a wake-up call to each and every one of us that we have a lot of work to do. Based on the fact that we've chosen this path, this shows that we've agreed and we've accepted that we are caretaker of man's most precious gift, which is eyesight. So all hands has to be on deck to ensure that the mission and the vision is achieved. So thank you once again, Luke, for that wonderful speech. So we'll be going on to the next speaker. So the next speaker we have for this wonderful section is Pemije Gadmo. I'm reading a little bit about Pemije Gadmo before he hands over this platform. Pemije Gadmo is a dedicated doctor of optometry, student at the University of Benin, Nigeria, with a passion for eye care and health advocacy. He is actively involved in various initiatives that promote optometry and community service. Now, these are his leadership roles. He's currently the founder of OptoGlobe, a global community connecting optometry students worldwide. He's also a global student ambassador for Know the Globe, promoting eye health awareness globally. He's also the vice president of S-Watch Uniben, student volunteer for optometric service to humanity, University of Benin. As a doctor of optometry candidate, Pemije demonstrates a strong commitment to the field of eye care. Through his leadership roles and initiatives, He's shaping the future of optometry and making a positive impact in his community and beyond. So, without further ado, I really want to welcome Femi J. So, Femi J, got more over to you. Thank you very much.
Thank you very much, Luke. Sorry, thank you very much, Samson, and everyone for having me. I don't know if you can see my screen.
Yes.
All right. Thank you very much, ma'am. So I would be giving a very, short and precise presentation on OptoGlobe, and I would be highlighting a conventional practice in healthcare and how optometry students can take part in this. So OptoGlobe is a global community of optometry students worldwide. And we have one mission: to empower optometry students worldwide to connect, learn, and advance eye care together. We've had events in the past, wonderful events like the Global Student Summit, which we had its premier uh, first ever section in 2024 last year, and that was in partnership with Bosch International. And this year, still in partnership with Bosch International and specifically co-hosted by S. Bosch Manila Central University. We've had wonderful events with the Arclight project in December 2024. Of course, we had a World Optometry Day webinar with the African Federation of Optometry Students earlier this year. We've also had a couple of events which we've partnered in and some which we will partner in before the year runs out. So okay, so how do you join OptoGlobe? You can become an individual student member, and it's quite easy. I think the link to become an individual member is in that. You can register your student association if you are the national president or an ESCO or someone who stands in leadership for an optometric student association in your country. You could register as a student association or association member for OptoGlobe. Our partners, we've partnered with Bosch International, NoDiglo, the WCO, and the Arclight project, amongst many other partners. So these are some of our activities and conferences. You can see our newsletters as well, which have been published every month, thanks to the wonderful OptoGlobe board of editors led by Tinelo Ekeli and of course Hudson. So we've done a work on childhood blindness where we raised awareness on childhood blindness. This was in September last year, and it was in partnership with NoDiglo, where we did a video contest raising awareness on childhood blindness, and we called this the Glow Awareness Contest. And of course, prizes were awarded to the first or top 5 videos, prizes ranging up to 1,200 US dollars. Of course, these are some of the videos, and I would just love to highlight the top 5 people who won. We had Joan Litwan, who was from the Philippines, Erica Levinson from the US, Dollars Wang from the US as well, Ranim Raed from Jordan, and Angel Aruai from Nigeria. So these are also some of our activities in events and conferences, summits as well. Okay, just highlighting. So down to the major discussion for me tonight. Yesterday, we had a wonderful breakout session, and we had a discussion on student exchange programs. And of course, I want to highlight sister organizations like OptoGlobe in other healthcare professions. And why OptoGlobe, I think, is a norm in healthcare and should be conventional. And I would be calling this the IFMSA IPSF example. The IFMSA, the International Federation of Medical Students Association, and the IPSF, International Pharmaceutical Students Federation. They represent medicine students and pharmacy students globally, respectively. There are also other international students association, like the IADS for dental students and even veterinary medicine, and all of them wonderfully, belong to an alliance, the World Health Student Alliance, which I believe OptoGlobe should begin talks soon to join that alliance. So what benefits do international student associations play? I'm just going to be modeling their activities here. If you can see, they've been able to play a crucial role in professional development, global health policy. They've been able to attract investment, build value for their profession. Even as students, they've led youth discussions at the executive board meeting of the World Health Organization, the World Health Summit, the United Nations, climate change conferences. And interestingly, they run a student exchange program. Just like Luke said earlier on, I think it's time. I think it's imminent. I think it's an uh, important discussion we should be having in optometry, where a student exchange program should be possible such that a Nigerian optometric student can travel to the US for his or her externship, and vice versa. A Ghanaian optometric student can travel to China for his or her externship, and vice versa. And I mean, this is very possible. It's not something that's impossible. It's something that can be done. I've had a couple of discussions with various institutions, various clinics, various stakeholders in the profession. And I mean, it even exists, but maybe not just on a global stage. And OptoGlobe hopes in the nearest future, we're able to create a pathway for a student exchange program globally where everyone is going to benefit. So also, OptoGlobe hopes, to get on the WHO Youth Council, just like sister organizations like the IFMSA and IPSF, who are on the World Health Organization Youth Council, where they are able to better advocate for global healthcare policies, even as youth voices. I mean, the truth is, nobody can do advocacy better than young people. I stand to respect everyone, but I mean, we have the energy, we have the voice, we have social media, the greatest tool currently, and we can lead advocacy very well. So these are great opportunities that OptoGlobe believes we can open in no time for optometry students globally. So ladies and gentlemen, at this point, I would love to invite everyone to join us at OptoGlobe. You can reach out to us via email, uh, and become a member of our organization. The membership form link will be sent in the chat. If your student association is interested in becoming an NMO, RMO, an NMO is a national member organization, RMO is regional member organization, or a university affiliate chapter, or you have a club, an optometric club, or student club that you want to be part of OptoGlobe, you can as well reach out to us. And I mean, all of this is for free. There are no due payments. It is entirely free. Nobody is going to be asking you for any money. So it's a great opportunity, I think, optometry students should join behind. We should all join forces and let's make a great impact together. Thank you very much, and a wonderful session ahead.
Thank you so much. Thank you so much, Femije, for bringing us this platform as the founder of OptoGlobe. So I guess, by the way, what has interested me the most in this speech is about the exchange program. I'm really excited about it. And I know it will be like a good addition, especially those who are in the clinical years, third year, fourth year. They can get a platform to expose their skills, maybe learn from other people from different countries. It will be a very nice initiative. Thank you so much. Thank you so much for that presentation. And as he said, there is a link in the chat for the associations for you yourself to be part of OptoGlobe. Yeah, make use of that chance and let's join this and make it a success. On to the next. Our next speaker is Manpreet Carol Chunga. She is at the forefront of delivering evidence-based, patient-centered eye care. She has a hands-on experience and it spans ocular disease management, contact lens fitting, and pediatric optometry. She is deeply committed to advancing as she steps into professional practice. She is known for her clinical curiosity, leadership, compassionate approach to care, and she's poised to make a lasting impact on the future of optometry. She has had placements and outreaches like Glasses for Kids and interdisciplinary vision screenings, and she has honored her skill in diagnosing and managing visual conditions across the diverse populations. So, ladies and gentlemen, join me and welcome Manpreet Kaur Chunga so we can listen and learn a lot from her. Thank you.
Hello, good morning and good afternoon to everyone, depending on which part of the world you're from. Firstly, I'd just like to thank OPTOGLOBE for inviting me to speak on behalf of Melbourne University optometry students and in general Australian optometry students. So for those of you who don't know me, my name is Manpreet Kaur and I'm a final year optometry student. It's a real privilege to be here today, not just as a student, but as someone who cares deeply about the profession, the future of our profession. So as future optometrists, we stand at a turning point, one filled with opportunity, but also great responsibility. We're in a unique position to contribute to a field that's evolving rapidly with new technologies and treatments. We're in a unique position to expand our scope of practice and also to address the growing community needs. Before we can lead that future, we have to first address the challenges that many optometry students are facing right now here in Australia, challenges that impact not only our ability to learn and grow, but also the sustainability and diversity of the profession as a whole here in Australia. So let's begin with one of the most pressing and widely felt issues, financial stress, especially during clinical placements. In our final years of study, we're expected to undertake long, often role-based placements with little or in some cases no financial support. Now, don't get me wrong, here in Australia, we are blessed to have many government aids such as youth allowance, and there are also funds to aid students such as Growing Rural Incentive, but the cost of living crisis going up, this support is barely just getting some students through. So a 2023 University of New South Wales survey found that over half of optometry students experience significant financial hardships during placements. So even though these placements are vital for our learning and development as professionals, they come with a burden, and that's travel, accommodation, and loss of opportunity to work part-time. So for many students, including myself, this means making difficult choices, sacrificing sleep to pick up weekend shifts, skipping meals to cover rent, or even questioning whether we can afford to finish the degree. So when students are forced to prioritize financial survival over education, it not only affects our well-being, but also impacts the quality of care we can provide during placements. So recently, the Australian government has introduced CPP, which is an incentive that aims to alleviate the financial burdens associated with mandatory unpaid placements for nursing, teaching, midwifery, and social work students. So I think it's time that optometry students were included in this conversation as well, because clinical education shouldn't come at the cost of our mental health, physical well-being, or financial security. Additionally, optical companies who play a large role in the Australian market could step in sponsoring students in exchange for short-term service commitments. The second challenge is a growing concern, and it's about workforce oversupply. Since 2017, the number of registered optometrists in Australia has risen by over 30%. Yet the job opportunities, especially in metropolitan areas, have not kept the same pace. So for many final year students, including this year's graduates, it's created uncertainty, stress, and doubt about their future career prospects. In a workforce survey conducted in 2024, 30% of participants outlined their concerns related to job demands, such as fear of job loss due to increasing number of optometry graduates and salary stagnation. This just highlights the urgent need for better workforce planning, stronger graduate support, and more transparent communication between universities, employers, and professional bodies to ensure sustainable career pathways for future optometrists. So despite there being an oversupply in optometrists, funny enough, there is another aspect to the story, which is the maldistribution of services across Australia. So this maldistribution is leading to a significant burden of eye disease that's not being addressed, particularly in rural communities. So while optometry is growing in numbers, the access still remains unequal, with more optometry schools opening in recent years. Workforce growth has outpaced demand, particularly in larger cities and regional areas. So whilst rural and remote communities are still underdeserved. So at Christian Medical College in Vellore, India, that's where I did my international placement. Optometry graduates have a 2-year bond that they need to complete, which I think is a great way to distribute the services equally. Optometry schools in Australia, I think, should adopt a similar system, such as introducing a rural bond scholarship to incentivize services and make this very transparent with students before they apply. I'm pretty sure they have something similar to this in medicine, so I think it would work well with optometry as well. Additionally, by expanding telehealth consults and contributing to efforts in telehealth training, that should also be done during the coursework as well. The next challenge is learning gaps. So despite the strength of optometry education in Australia, there's always room for improvement. So many students experience notable learning gaps that impact their confidence and readiness for independent practice. Advanced procedures like lasers, injections, and prescribing oral medications are introduced, but they're not explored in advanced detail due to the exclusion from the current scope of practice. This limited exposure means graduates often feel underprepared to manage complex cases independently, particularly in rural or underserved areas where access to ophthalmologists may be limited. I can just give one example of a patient that I saw just the other day who didn't actually have a complex issue, but a fairly straightforward condition. She had a fairly large internal hordeolum. I advised her to do warm compress 3 times a day for a week, and if it didn't improve, to see her GP for oral antibiotics. So while my management was clinically appropriate, it involved delay, inconvenience, and added pressure onto the already struggling healthcare system. So if optometrists had the authority to prescribe oral antibiotics, I could have provided immediate effective care, saving the patient time, discomfort, and making more efficient use of the healthcare services. So this example just highlights a key learning gap for optometry students. While we're taught about the clinical management of such conditions, the lack of practical training and prescribing rights mean we can't fully apply this knowledge in practice. So by expanding both the scope of practice and depth of training in these advanced areas would better equip students to meet future healthcare demands, reduce burden of disease, and improve patient outcomes, all while using resources more effectively. Countries like New Zealand and parts of the United States already allow optometrists with additional training to prescribe oral medications and perform advanced procedures safely and successfully. So if we're serious about future-proofing the profession here in Australia, we need to build that pathway, starting with education. Giving students the opportunity to develop these skills during training will ensure that they're ready to take on greater clinical responsibility from day one. Ultimately, preparing students for this kind of role won't just benefit graduates, it will ease pressure on the overstretched ophthalmology services and improve access to timely care for patients across the country. So these issues may seem overwhelming and complex, but they need to be addressed. Placement poverty, graduates oversupply, learning gaps aren't just student problems, there are profession-wide challenges that directly impact the future of optometry in Australia. If we want a system that's sustainable, equitable, and responsive to community needs, we need to start listening to those who are training to carry that future forward. So thank you all for listening and being part of this conversation. And I would finally like to acknowledge the unique value of platforms like OPTOGLOBE, which connect optometry students from all around the world. So by engaging in international conversations, we're exposed to different models of care, wider scopes of practice, and innovative training systems. So learning from different countries like New Zealand, the US, or India helps us reimagine what's possible for our own profession in our own country and reminds us that we're part of a global effort to improve eye care. So thank you, OPTOGLOBE, for creating this space where student voices are heard and where collaboration and innovation can flourish. And thank you guys for all listening and attending. Thank you.
Thank you, Ms. Manpreet, for that wonderful section. Thank you for taking us through the challenges we are actually facing globally. So this is to each and every one of us that are present in this section. There is a need for us to actually participate in the global change. And one of the platform whereby we can actually join in this advocacy is through OptoGlobe. So if you're here to join, please you can go through the chats to actually check some of the messages to fill in the form and be part of OptoGlobe, be part of students that will actually move in this advocacy globally. So thank you very much once again, Ms. Manpreet. And without wasting much of our time, we'll be going into the next and the fourth speaker. So the person we're having is Afelele Potia Medikiza. She's a final year optometry student at the University of the Free State, South Africa, and the president of the African Federation of Optometry Students, AFOS. AFOS aims to enhance optometric standard and vision health across Africa. Afelele holds a Bachelor of Science in Microbiology and Entomology and discovered a passion for eye care after completing her degree. She has been active in organizing vision outreaches, volunteering, and working part-time at Merlin's Eye Style since her first year. Additionally, she serves as the president of the UFS SVOS chapter and leads operation for the Bafakemist, please pardon my pronunciation, an NGO focused on medical and outreaches and women health advocacy. Our goal is to improve eye care accessibility throughout Africa, guided by the AFOS slogan, One Vision, One Africa, better sights everywhere. So we'll be giving this platform to the AFOS president, Afelele Pochiamedikiza. So, Ms. Afelele, the platform is yours. Thank you very much for joining us.
Thank you so much, Samson. Thank you so much for that amazing introduction. I'll just wait for the team to upload my slides. Thank you. Greetings to all dignitaries, optometrists, and optometry students, both students here in Africa and in other continents. I would like to extend my gratitude for the invite to be a part of the Student Summit 2025. And I have to say that I have learned a great deal from my fellow optometry students and the professors and professional optometrists that were speakers in the previous days of the summit. I truly got to see through the lens of diversity within our profession, as per the theme for this year's summit. Speaking before you, as Samson said, my name is Aphelele Madikiza. I am a final year student at the University of the Free State in South Africa. I am the AFOS president. Now, I will just give a brief overview of who AFOS is and what we stand for. Right, so you can go to the next slide, thank you. So AFOS is an acronym that stands for the African Federation of Optometry Students. AFOS is a student-led organization encompassing optometry students across Africa. The founder of this amazing organization that empowers students is Dr. Levi Osuwagu. He is a senior lecturer and academic lead at the Rural Health School of Medicine in Bathurst in Australia. The vision that AFOS has is that of creating a unified community of optometry students across Africa, committed to advancing eye care excellence, fostering collaboration, and breaking down barriers to vision health access, thus ensuring a brighter future for all. And our mission is to empower African optometry students through collaboration, knowledge sharing, and advocacy to promote equitable access to high quality eye care by fostering professional development, promoting preventative eye care, and advocating for policy changes. We aim to elevate optometric practice standards and improve vision health outcomes continent-wide. Next slide, please. And currently, AFOS has established contact with over 30 optometry schools in Africa, with representatives from each institution. Now, in the next slide, I will be now delving into the theme that OPTOGLOBE, together with the SWASH MCU, came up for this year. So as I saw or rather as I read the theme, I just really felt like I want to dissect it, bit by bit. And I'll start with the first part that said the lens of diversity. When I read that, I just got the impression that optometry itself is so diverse. There's so much diversity in optometry. And I just want to first begin by saying that optometry is a profession that has been respected and recognized in the healthcare system since the invention of spectacles in the 1300s. The profession has evolved from being known to offer refractive error correction and now having to, rather it has subspecialties or niches, if you will, within the profession. To name a few, we have contact lenses, low vision, binocular vision, and pediatrics, also pathology as well. So it has really evolved over the decades. The World Council of Optometry defines optometry as a healthcare profession that is autonomous, educated, and regulated, meaning that it is licensed and registered. And they also, the WCO defines an optometrist as a primary healthcare practitioner of the eye and vision system who provides comprehensive eye and vision care, which includes refraction and dispensing, detection, diagnosing and management of diseases in the eye, and the rehabilitation of conditions of the visual system. Now, the importance of optometry students knowing about the diversity in the field is vital and crucial, as we are all different and we have different personalities. For example, some people love talking and they love, the business side or the corporate side of optometry, and one day they would like to open a practice because they have the heart of business, and another person might be passionate about public health and advocacy and leadership, like myself and the founder of OPTOGLOBE, Pemije, my good friend. And someone else might just want to be working behind the scenes with a team of researchers and innovators, and that's how we get to grow as a profession in terms of our research. Now, I just want to just say that as AFOS, we had an event last year. The title of the event, it was the Diversity of Career Options in Optometry. Can I get the next slide, please? And I just found it interesting that as we had that event as AFOS, I saw an optometrist that came in that was working with a very well-known brand and a very respected one at that. The optometrist was working with Apple, so he was in the research in the optic side of Apple. So I was like, all one needs to do great things is to find their passion and align it with their vision. And the keywords there are passion and vision. So I just want to say that the field of optometry is vast and there are no limits to what one can achieve. And can I get the next slide as well? Thank you. So I just had to mention that optometry is quite a vast field. So moving on to the second point, we can move on, thank you, to the next slide. So now moving on to the part of the global optometric education, we heard, the past 3 days, different students, leaders at that, coming from different walks of life, from different continents, talking about their experiences in the optometric education and how it is in their countries. I would just be going through a rundown of the optometric education in Africa. So that's what I'll be focusing on right now. So an article written by Samson Abu in 2020 gives the history of how optometry education came about in Africa. In the year 1924, the first ever optometry institution in the African continent was founded in South Africa. Now, as I read that, I just had to, because I'm from South Africa as well. I'm a final year student in South Africa, and I was just taken aback, and I just felt grateful, of being in the very country that this great profession was established in. So after the establishment in South Africa of the optometry institution, 3 additional countries in 1993 established optometry programs in their institutions, namely Ghana, namely where PMJ is right now in Nigeria, and Tanzania. A publication by the International Agency of the Prevention of Blindness stated that there are approximately 27 optometry schools in the 15 of the sub-Saharan African countries. Now we can go to the next slide. Thank you. So now I just put this table, which came from the same article I mentioned earlier, written in 2020 by Mr. Abu. So if we are looking there at the top, the table on the slide shows all the institutions across the African continent. As you can see there at the top left corner there, the topic is sub-region rather. The heading rather there is sub-region. And as we see, they have been arranged in the order of their sub-regions. So we have the northern, the southern, the eastern, the western. But if you're an African, you know that there's one sub-region that's missing in this table, and that is the central African region. Now, the years in which the optometry institutions were established are also clearly stated. But as I said, as an African, you will see that there is one region that's missing, and that's Central Africa. I would like to believe that if there is no institution offering optometry education in a region, then it means there are millions of people that do not receive any form of eye care services, or maybe very just handling of maybe severe cases like injuries to the eye. But one would think that there's really absolutely no eye care services for the central region, because they don't have any optometric education in the region. So to me, I feel this calls for us all around the continent and the globe to stand together and advocate for areas such as Central Africa to establish an optometry institution, which in turn helps us decrease the number of preventable blindness in our continent as a whole. And yes, you can go to the next slide, please. Just looking also let me just comment on, the optometric education and the challenges that we face. Apart from just the shortage of optometry institutions in Africa, there is a crucial issue and almost a danger to the profession itself. And this issue, if it's not addressed, really I fear for the future. But because we are here and we're talking about it and we're advocating about it, I have so much hope and faith in us all here as advocates and leaders that our voices will drive the change. And the issue that I'm referring to now in African optometric education is that there is a differing, there's differing levels of qualifications at which optometry education and training is offered at. And by this, I mean, for example, here in South Africa, we have a 4-year bachelor's degree. So you graduate with a bachelor's degree. And if you ask Pemije right now, he's in Nigeria, he has to study for 6 years for his, optometry degree, and he will be a doctor of optometry. And if you ask students anywhere else in Africa, they'll tell you, it's a diploma in my country, or it's a BSc in my country. So really, This disparity alone is a potential threat to the integrity of the profession, as I believe our local governments will see the need of optometry and begin to incorporate us in the healthcare system when we strengthen and advance the level of optometry education in our respective regions. Hence, we call for the standardizing of the optometric education in Africa and around the world. So yes, the challenges I've heard from the first day until now, we have challenges around, our clinical facilities where we are being trained as optometry students, where we're lacking equipment. The other challenges that I've faced myself is a lack of funding to fund the degree, right, so that you need to become an optometrist. And I'm part of an organization called AFOS, as I mentioned. I'm the president of the AFOS, and we are very glad that we have gotten support from organizations such as Bosch International, such as the American Academy of Optometry, and other organizations that I can't mention now. They've been really supporting us as students because we have taken it to ourselves that, okay, we can't just talk amongst ourselves and complain amongst ourselves. We need to go out there and try to advocate for ourselves and for the future students when we become professionals one day. So as AFOS, we spoke to Africademics, and they have, or rather we have come up with a partnership with them. And if you're signing up as an African optometry student at the Africademics, we will be sending our information in the chat as well. You can ask us more about that, sorry. So we have a scholarship, or rather we are partnering up with Africademics, where you can apply for scholarships in their website. So I really had to mention that for anyone that's struggling with funding, wherever you are in Africa, you will be able, you just need to be an AFOS member. And yes, I'll drop the email in the chat and you can ask for more details in becoming an AFOS member. But yes, moving forward, we can go to now the next slide. So yes, now we're moving on to, I'm gonna just speak briefly about, you can go to the next slide, please. I'll be speaking briefly about the challenges that we encounter when we are now professional optometrists. Yeah, next slide, thank you. So yes, as I mentioned, the improvements, I think you went a little bit too far. There's a table in black and white. You can just go to that one. Yes, we can, yeah, this is the one. Thank you so much. So now I'll just give an overview of the public versus the private sector in my country. And now this is the reality that we face as professional optometrists. So when we look at now the factors, the first factor, and this is a comparison between public and private sector. So the first factor is that optometrists that are employed, the percentage approximation rather of the optometrists that are employed in the public sector, it's 6 to 7% versus the private sector, it's 93.3%, right? So there's a huge disparity in that. And then the next factor is that the population coverage is 70 to 84% in the public sector, and in the private sector, we have 16 to 30%, and usually these patients are insured, the working class usually, so they are fee-paying clients. And looking at the third factor, we have optometrists to population ratio. Now, in the public sector, so this means that you're working in a public hospital, it could be primary, secondary, tertiary level, but you're looking at to one optometrist is to 150 patients. But in the private sector, you have one optometrist is to 4,500. And just looking at the urban/rural split of the population, in the public sector, we have a concentrated in training provinces, and it's usually the rural areas, and they are very much underserved. And in the private sector, it's primarily urban areas and are very much well served. And then we have the service rendered scope. There underneath there, we have the underutilized, limited, mainly cataracts and therapeutic needs. And then in the private sector, we have a full scope of services. So this is just to highlight that, the advocacy side of optometry will still continue for us, even beyond being a student. But we will not stop. As students, we'll still advocate for, when we start working, that can our local governments employ optometrists in the public hospitals, because that is where the need is, right? And they come from rural areas, and they, don't have the funds to get themselves the eye care that they deserve, the quality eye care that they deserve. And there's this very, I don't know what to call it, but sometimes optometry is seen as a luxury, whereas it's really a necessity for people that are in the rural areas, for that small young child that is sitting in front of the class and wondering why can't the other students see the board and he's the only one. So advocacy will definitely continue, and we will continue to be the mouthpiece for those that cannot speak for themselves. And just speaking again about just the overview of the optometric education, I was invited to be one of the panelists last month. A group of very respectable and giants in the profession, head of departments in our African continent, wrote an article. The title of the article is Mapping the Landscape of Optometric Education in Sub-Saharan Africa. And this is the most recent article, really, that's mapping the Sub-Saharan African optometric education. And as I was a panelist there, I just really felt that if organizations such as AFOS, the one that I come from, or rather the one that I'm representing right now, if such organizations did not exist, I would not have been a panelist on that very insightful discussion. So I truly am thankful for the opportunity of each and every, being given the opportunity and the support from organizations and even head of departments and optometrists, because now with that, just attending and just being sort of the mouthpiece of students, they, as a collective, the authors of the article said that can I just lead, a forum where I will choose students from different countries, and we will be the students that will sort of like be the leaders of, just advocating the optometry education, and we'll have another event where we have more talks on the advancement of optometry education in our continent. And you can go to the next slide, please. So as I feel like we've been reiterating the same things, there are many challenges in optometry, ranging from the access of, us to the rural communities, that we could learn more pathology cases and be able to manage cases that will in future teach us to be better clinicians. But really, it's up to us to be the trailblazers in advocating for ourselves and for our education, because at the end of the day, it'll be us who are in the working field and feeling like we're not ready yet to be, the 21st century optometrist. So yes, you can just go to the next slide for me. And also, yes, the next slide as well. You had skipped these ones, and the next one. Yes, so with that being said, I would like to just close. And in closing, I would like to thank OPTOGLOBE and SFOSH MCU. I would like to thank all the optometrists, the optometry students, and organizations like VOSH International, the WCO, for supporting gatherings such as these, where we have student leaders across the globe learning together and talking about the different issues that affect us as students. So I just want to urge that we keep having these conversations, we keep networking and having these networks, and we need to get into the spaces that we feel that we can give, in terms of where we're passionate in. And we need to advocate while we are students for our beloved profession. Advocacy is a movement. We need to continue to advocate for access to quality eye care for all. Eye care is not a luxury, as I had said before, but it is a necessity to the small African children out there, and even to the elderly that don't know that they have cataracts and it's a preventable blindness. So with that being said, I hope that we leave today not only inspired by the different student leaders that shared very insightful presentations, but let us be the 21st century optometrists, right? And in my view, the 21st century optometrist redefines what it is to be an optometrist in the everyday, in this world rather that we live in. I would like to leave behind to students, listening today, that passion in any field is the fuel that will take you even beyond what the eye can see. The future that you envision is up to you to bring it to reality. Thank you for listening, and I hope to see you all very soon.
Thank you so much. Thank you so much, Afelele, for that wonderful presentation. Yeah, we are talking about connecting as optometry students internationally, but I think it starts from your school, it starts from your continent as Africa, before you go ahead to go to other continents like India, like Asia, Europe. Yeah, I think it's good to first connect as optometry students in your very own area, and then we can move on and connect to the other areas. That was a wonderful presentation. And in the chat, I was reading through the chat, I saw some universities are not yet part, or some students are not yet part of AFOS. They've shared a link. Make use of that link, join AFOS, and we can get to connect as students and have the best of it. Thank you so much. Thank you so much, Afelele Madikisa, for your presentation. So on to the next speaker. Our next speaker is a fourth year Doctor of Optometry student at Kwame Nkrumah University of Science and Technology, and he has a passion for advancing the field of optometry and promoting global collaboration. As the president of the Optometry Students Association of Ghana, also the International Relations Officer-elect for AFOS, and the Deputy Speaker of the Science Students Association Senate, he has developed a strong leadership, organizational, and communicational skills with a proven track record of successfully managing teams and events, and is committed students to become leaders in their communities. So everyone, join me and we welcome Henry Tiamo. Henry, the platform is yours. You can share with us. Thank you.
Good evening, everyone. Uh, Hello.
Let's go on, Henry. We can hear you.
Hello, we can hear. We can hear.
All right, thank you. I'm having a bit of network issue at my end, and so pardon me if there are some hitches in my delivery. So good morning, good afternoon, good evening, everyone from wherever you are listening from. To the distinguished colleagues, to the faculty, to students, and then to the guests invited here. Um, Good day. I first want to thank God for this opportunity, and then also to thank the founder of OPTOGLOBE, Pemi J. Gadimo. Thank you very much for this opportunity to speak on this symposium, The Lens of Diversity. So as the host rightly said, I am Henry Ntiamwa, and I represent the Department of Optometry and Visual Sciences at the Kwame Nkrumah University of Science and Technology, KNUST, Ghana. The host said I am the International Relations Officer elect. That was when I submitted the portfolio to them. Now we've been sworn in, so I am the International Relations Officer for the African Federation of Optometry Students, AFOS. And it's a great privilege to speak on a theme that resonates with every student in this room, the global optometric education, its challenges, and how we can improve it through our shared experiences. And so I'll make it very brief and then very quick. Optometric education in Ghana and specifically at KNUST is rich in theory and clinically grounded and then increasingly integrated with public health needs. As students, we are proud to be trained under a program that produces primary eye care professionals capable of serving a wide range of communities. So in Ghana, initially, I think for the past around 5 or 6 years ago, there were a bit of conflict between optometrists and then ophthalmologists, uh, as in based on the scope of practice. Ophthalmologists felt the optometrists here in Ghana. Ophthalmologists felt optometrists here in Ghana are going a bit into their field, and then the optometrists felt they're also being limited. But as now, as per the Ghana Optometric Association, they've they've been a scope of practice for optometrists, and then there's also been a clearly defined scope of practice for ophthalmologists. So, however, in looking through the lens of diversity, as our theme suggests, we recognize that educational experiences vary not just across countries, but within institutions and then even within classrooms. While our curriculum is strong and our faculty committed, the tools and environment we learn in matter deeply. Unfortunately, in Ghana here, we face a bit of challenges in the optometric education, specifically here in Kwame Nkrumah University of Science and Technology. One of our major hurdle is limited access to updated clinical equipment. And so in here in my school in KNUST, as Aflele Riley said, in Ghana, we also practice the same way, or our education is structured the same way as in Nigeria. We also have the Doctor of Optometry OD degree for 6 years. And then after your 4 years of theoretical education, you are being ushered into your clinical education from a level 500 and a level 600. But one major hurdle we are facing is the limited access to updated clinical equipment. And so, clinical students in the clinical years find it a bit difficult to get access to these updated clinical equipment, which is a bit of a major issue here in Ghana, Kwame Nkrumah University of Science and Technology. So, in disciplines like retinoscopy, slit lamp biomicroscopy, contact lens fitting, the hands-on exposure is vital, as we all know. Yet sometimes it's constrained by the number of available working. It's constrained by the number of available working instruments, and then lab space is often stretched beyond capacity, especially during practical sessions. Learning optometry in a space where you cannot practice adequately is like studying surgery without a scalpel. And then the theory may be sound, but the skill cannot mature. And so all this is emphasizing on the point that there is limited access to updated clinical equipment. And then there is the challenge of clinical exposure. While the Kwame Nkrumah University of Science and Technology provides valuable practical experience in our final years, the demand for supervised patient interaction far outweighs the clinical time available. But thankfully, now the academic year has been structured in a way that we start the academic year in January, and then in August we'll complete the academic year. And so from September up till December, that will be the long vacation, which gives students enough time to be clinically exposed to enhance their clinical competency. And so during these long vacs, we give students internship forms so that students can practice or have internship sessions in various hospitals across the country, which is one of the major things that helps improve our students' clinical competency. But in the school or in the university, one of the major problems we are facing is that there is lack of clinical equipment to train students. And that's the major problem we are facing here in our optometric education. But not everything is a challenge, as we all know. As I said, internships, placements during long vacs have been one of the most beneficial aspects of our training. These attachments to hospitals and eye clinics allow us to translate classroom knowledge into real world skills, interact with patients, and then work under mentorship, often across different regions and then facility levels. And so, as the host rightly said, I also happen to be the Optometry Student Association of Ghana, KNUSC chapter, happen to be the president. And so this year I tried and then liaised with the Department of Optometry and Visual Sciences and in organizing alumni sessions a monthly alumni session for the students, where students are connected to real world mentors. They are connected to optometrists who are practicing optometrists who are in the United States, who are in the UK, doing their PhDs and stuff, so that students are motivated by these optometrists to be also motivated and be empowered to go into this optometric profession. And so I think that's also one positive, or the one thing I think it has really enhanced the clinical competency of the students here in Ghana. And then these programs expose us to the real diversity of optometric care, from rural outreach to urban clinics, and then should be expanded and better coordinated across all optometry schools in the country. And then I would also suggest it to all optometry schools in Africa that mentorship sessions are very, very vital to students upbringing. I am a critical example myself. When I was in first year level 100 optometry, I almost left the course because I didn't have any solid foundation in it. But I was introduced to a 600 level student who mentored me, who spoke to me about the course, who spoke to me about the profession, and then everything about it, which gave me a very solid foundation on how the practice goes about. And so I'll suggest to all optometry schools here in Africa and then in the world that mentorship is one thing that goes a long way to help students. And so I'll touch on the things we need to improve here in Ghana, and then in Africa as a whole. So first, investment in equipment and infrastructure must be a priority, because we know this profession is a clinical profession. In as much as we are giving students a theoretical knowledge, it's supposed to be a profession that's a hands-on practical session. And so there should be investment in equipment and infrastructure, simulation labs, digital retinoscopy units, and fully equipped vision therapy rooms are not luxuries, but I feel they are necessities which are supposed to be in every optometry university here in Africa and in the world. And then second, I suggest there be inter-institutional partnerships. So global optometry schools should share resources, conduct joint online workshops, and then facilitate student exchanges. That is diversity in action, of which I'm very glad to be part of the AFOS co-executive team. That's one of the main aims of the African Federation of Optometry Students. And so if you are a student here on this call and then your university is not part of AFOS, I would like to encourage you to get in touch with the president, Aflili, so that we get in touch with your university and then the university becomes part of the African Federation of Optometry Students, because we are trying to get all students in optometry in Africa unified, so that we share knowledge, we share resources, and then we are all fully equipped as part of the inter-institutional partnerships. And then the third, more flexible curricula. We feel there should be a more flexible curricula here in Africa or here in Ghana that include teleoptometry, public health models, and entrepreneurship, because we know this world, or the world, is currently advancing, and the curriculum we are currently using is a bit outdated, if I may put it that way. And so if there is a flexible curricula that will include AI stuff, that will include public health model, that will include entrepreneurship, that would furnish our students, that will give our students the real world or the practical things that are happening in our in this current century. I think it would go a long way to help the current students in Ghana and in Africa as a whole. And so, to conclude, optometric education is not just about learning to refract or to diagnose. It's about preparing professionals who can adapt, who can innovate, and then serve across borders and then beyond barriers. We may be in Ghana today, but as students, we are part of a global eye care ecosystem. And let's keep looking forward through the lens of diversity and ensure no one is left behind in vision care. And thank you so much once again for being part of this symposium, or being part of this seminar. And then thank you once again to the founder of OptoGlobe for this opportunity to unite optometry students in the world. Thank you all so much for your time.
Thank you very much, Henry. Thank you very much for that wonderful presentation. We were able to benefit that mentorship is quite a key in terms of addressing one of the challenges we're facing in optometry globally. And also thank you for also stating some of the challenges that optometrists and aspiring optometrists are facing in Ghana. Thank you very much once again. And these things are taken into consideration. Thank you for delivering that speech. So without wasting much of our time, we'll be going into the final speaker for the day. So The speaker we have today is a recent graduate of optometry. He just concluded his Doctor of Optometry program at the University of Benin, Nigeria. His current work includes a comparative study of mobile-based near visual acuity art and a systematic review on the low treatment rates of eye emergency in Africa, one of which has been published in the World Journal of Methodology. He is deeply committed to expanding access to eye care in undeserved communities. He has led large-scale outreach initiatives across several communities in Nigeria. He also contributes to eye health awareness campaign and served as a design team lead for the Retina Initiative social impact efforts. Alongside his clinical and research work, he engages in global leadership and development and is an alumnus of the Millennium Fellowship, the Harvard Aspire Leaders Program, and the Kektal Youth Leadership Program. Please join me as I welcome Onake Ojo. Thank you very much for joining us, Onake Ojo. The platform is yours. Thank you very much.
Thank you very much, everyone. My name is Onake Ojulu, just like I've been introduced. And just before I start, I would like to appreciate OptoGlobe for this platform connecting students all over the globe. Um, uh, I'm about sharing my screen. I believe you can all see.
Yes.
Okay. Sorry. Okay, so I'm going to be talking about a research paper. This was actually my undergraduate thesis comparing visual applications to our conventional near visual acuity card. And in these times of emerging technologies, we use mobile applications for various optometric procedures, just like visual acuity testing, contrast sensitivity, and a whole lot more. So I'm actually comparing this work compared the use of these applications for testing near visual acuity. So for the introduction, so one of the most vital senses for humans is vision, and certain pathways are important for vision to occur in the human eye. So it includes the retina's ability to transport and interpret visual stimuli, and light reaching the retina with proper refraction, and the retina's overall health. So to identify any change in vision, it is critical to evaluate visual acuity consistently. The visual acuity is a measure of the eye's capability to discern shapes and details of objects at a specific distance. It's more like a measure of how well we can see. So near visual acuity measurement is essential in assessing the clarity of vision at close distances, essential for tasks like reading, just like you are looking at your mobile device now, your near vision is required for that. And traditionally, clinicians have relied on standard near vision charts. However, in recent advancements in technology have introduced these mobile applications to facilitate near VA testing using mobile devices like our smartphones. And these mobile applications, such as WHO Eyes and the Eye Handbook application, which was used for this study, they have been developed to measure near visual acuity, providing a convenient, portable, and accessible solution. So this study aims to bridge the knowledge gap by validating, it was meant to validate, check the retest reliability and the accuracy of these applications in comparison to our annotation visual acuity card used in the clinic. So I think I've covered the objectives. For the materials and methods, the study design was an experimental study design. It was conducted at the Department of Optometry Clinic and the University of Benin, Nigeria. And the study participants were 158 individuals aged 18 and above with a near VA of N16 or better. And the tools used were the annotation cards, the WHO Eyes application, and the mobile application. So the device used for this study was an iPhone 13 Pro with anti-glare screen protector. The brightness was at maximum to ensure the participants were able to see the optotypes on the device clearly. So for the description of procedure, each participant underwent near visual acuity testing using all three methods, the annotation card, the WHO eyes, and the eye handbook app. So each eye was tested separately and twice as well to assess test-retest reliability. The right eye was tested first and then the left with proper occlusion. Participants used prescribed near correction if they had any. So if they used glasses for near reading prior to the study, they were asked to continue using it. And for the WHO Eyes app, the optotypes used in the app were the tumbling E optotypes. So the E were facing different directions, and the participants were simply asked to swipe in different directions of the screen where the E arms were facing. And the eye handbook app offered various optotypes. The testing distance for all the apps and the card was 40 centimeters, was measured with a meter rule, and all tests were done using iPhone 20 and the iPhone 13 Pro as mentioned previously. So as app-specific instructions were strictly followed for consistency among or across participants. So for the data analysis, the near VA results were converted to their logmark equivalents. So there's a logmark conversion table which was used for this study. And for observing or for checking the relationship between the variables, a paired sample t-test was used, an ICC test, an ANOVA test, scatter plots, and a blonde Osman plots were used. An SPSS was also used to perform the statistical analysis. Also, this is a picture of the logmark conversion table. Okay. So ethical clearance was obtained from the Department of Optometry Research and Ethics Committee at the University of Benin, and it was in accordance with the tenets of Declaration of Helsinki. So for the results, a total of 158 participants were included in the study. So the age range was 22.56 plus or minus 2.29 years. So majority of the participants were female, 57.6% of the total participants were female. The near VA measurements for HI was done using three methods. And the observation from this study was that the WHO eyes and the eye handbook apps, they consistently produced lower logMAR scores compared to the annotation card. So while the app scores ranged from 0.10 to 0.14, the annotation card showed higher values between 0.18 and 0.20. And this indicated that the apps were overestimating the visual acuity of the participants. So for test reliability, which was also assessed in this study, it was strong for the annotation card. The ICC was over 0.96. And for the apps, it was less than 0.21, where this reflects inconsistent results. Per t-tests, it confirmed that these differences were statistically significant with a p-value less than 0.001. So repeated ANOVA measures show the significant effects of the measurements method with large effects for both eyes. The Bland-Altman plots also revealed poor agreement between these applications and the standard method. So for the discussion, the results show that both apps overestimated visual acuity by producing lower logMAR values than the annotation card. So these differences were statistically significant with p less than 0.001 and suggest a consistent measurement bias. So test research reliability for the annotation was greater than 0.96 with the ICC, was poor for the apps. And these findings were also supported by our ANOVA measurements. Also, the Bland-Altman plot also highlighted the app's lack of agreement with the gold standard, which in this case is the annotation VA card. So a few reasons that may account for this discrepancy between these mobile applications and the annotation card So the variation may be due to factors such as screen resolution. So various mobile devices have different screen resolutions. So the F14 Pro used for this study might be different from what was used in previous study that showed agreements between the apps and the annotation card. So the screen resolution may be different. The optotype contrast also. There is also the pixel density, so that might also cause variation among mobile devices that might lead to um, these results. And the type of reference charts. So there was another study where the Rosenbaum card was used instead of the annotation, and this study showed consistency between the apps and the card. So this may also account for the explanation for the different results we got in the study. And for demographics factor, the participants for this study were young university students, unlike other studies where older or more diverse populations were used. And device-related differences, like I mentioned, pixel density, brightness, and also procedural factors could have affected the accuracy. So in conclusion, study revealed that these applications tend to overestimate visual acuity and lack the reliability needed for clinical use. And the inference from this study is that future research should focus on optimizing these applications by refining their measurement algorithms. Until then, the annotation card remains the preferred method for near visual acuity assessments. So thank you for listening. And in case there are questions, I'll be happy to take them in the comment section. Thank you once again, OptoGlobe, for this opportunity.
Thank you so much. Thank you so much, Arja, for that wonderful presentation. Thank you so much. I think I also saw a document about the retina. I didn't read about it a lot in detail, but I read just a few pages, and I think it's a very good document. And I think everyone should take time and read through it. Thank you so much. Thank you so much. And on to the next, we shall have a question and answer session. If you have any question, the students, you can write it in the chat. We shall be able to take up the questions. We shall read your question and we shall get the answers. To start up on our question and answer session, I would like to ask my question to Mr. Pemije. My question is like this. Like my inquiry, I would like to ask about how we can make these global optometric platforms more accessible to like the underrepresented students. For example, some students, obviously some optometry students cannot access like these platforms. I know there are some students that do not know that even we have a summit. They do not know the about anything. So it's so hard for them to access these platforms. For example, in the chat, I saw some people when I think the Air Force president was presenting about the whole Air Force issue, and then the Central Africa, I saw some people saying there's already an optometry school in Central Africa. So I think it's so hard to like for these marginalized communities or underrepresented regions to have like maybe their access to the global opportunities, maybe to express the challenges they are facing, and maybe access opportunities like the conferences, the international networks, scholarships, mentorships, and all that. So as inquiring on how we can do better in that section. So as inquiring, maybe if Mr. Pemije could answer that question. Thank you. Otherwise, you could keep asking your questions in the chat and we shall have them answered. Thank you.
Thank you very much, Blessing. That's a very good question. There are so many underrepresented student groups, across the world, in Africa, and in Asia, across the world, even in some parts of Latin America. I think the big issue is for us at OptoGlobe, we are open to all. We do not have any elite kind of movement per se. We're just a few people, and I think it's the same for AFOS. AFOS is also open to all. So I think where we encounter issues are that in some certain countries, there are some form of limitation on optometry students uh, forming student associations or even joining one. Some countries unfortunately do not even have an optometric association for practicing optometrists. So it is kind of difficult for you to reach out to those countries and try and organize them. For example, the Democratic Republic of Congo have been in touch with the DRC, I think since late last year, and I've known a few of their students, but it was just quite difficult, to build a structure with them in OptoGlobe. I've even, introduced them to AFOS, just because then they didn't have a student association. But I'm glad that it was last month they established a student association in the DRC, which is CEC for short. And of course, they even have an S-Bosch chapter in Honu. So I think going forward, they would no longer be underrepresented in OptoGlobe. They would be given, as much priority as every other country that has student association. So I think the first step, if you are here listening to me, you are from a country, you feel your country is underrepresented, you can reach out to me or the OptoGlobe mailing address. I will drop those email addresses. And of course, it will be good you connect us with your student association if there is in your country. You could, if you are the leader of that student association, you could register your student association as a member organization of OptoGlobe, or you could become an individual member if your country or school does not have a student association. So I think those are the ways we can work with students across the world, from places we see as underrepresented. And I think another big challenge we face, and even I believe AFOS as well faces, is the language barrier, where it's quite difficult. You're meeting somebody for the first time who speaks an entirely different language from what your team can speak. For example, at OptoGlobe, we can only communicate with you in English, French, Spanish, Arabic, and I think Portuguese. But because those are that's our capacity. But then when you have people who speak other languages than this, maybe trying to connect with students in China, we've attempted that, and it wasn't so smooth, as well as governmental censorship in some countries. For example, in China, OptoGlobe has made moves countless times to connect with the optometry students. We've communicated via email, but it's very difficult to reach out to the students because there are some form of censorship on them joining events like this, because obviously Zoom is banned in that country. Likewise, some other countries in the world. And then they want us to probably have a special event for their own students with an application. And then I in Nigeria, for example, could not open an account with their messaging app, which they said I should join because I'm not from China, and I need somebody in China to, let me into their app. So you see, there are so many issues, and we hope gradually with time we are able to work, with stakeholders across board to see how we can maneuver through it. But I think by the next Global Student Summit, there will be no underrepresented group. Everybody will have a voice. And by God's grace, it will be much more bigger, than what we have today. Thank you very much.
Thank you so much. Thank you so much, Femije, for that contribution. And I think before you leave, there's someone who was asking how they can they can join the OptoGlobe WhatsApp group and how they can connect to the presenters. So I think you can reply to that quickly before we go to the breakout rooms shortly.
All right, thank you very much, Blessing. I can see those questions in chat. So I think you just have to do one thing to join the OptoGlobe WhatsApp group. Initially, the OptoGlobe WhatsApp group was open for everyone to join. I could have just sent you the WhatsApp invite link here. However, we've put some restrictions on it as spammers and some other kind of people had access to the group. So I don't know if there's anybody on the organizing team here that could just help me paste the OptoGlobe membership form in the webinar chats. It's in the chats already, but I think probably somebody could help out in sharing it again. So once you fill out the OptoGlobe membership form, you would receive an invitation link to join our WhatsApp platform. I do not know if it's possible having it sent instantly, but every month end when we send out our monthly newsletters, we always attach our community invite link as well for the presentations or presenters email addresses. We will transmit that upon their approval, because I understand there is also privacy to sharing people's contact information. So we'll speak with our presenters, and of course, if they approve, we would share all their email addresses to the OptoGlobe WhatsApp platform as well. And if you are a presenter here and you would love to connect, or you would love persons here to connect with you, you could also share your email addresses in chat. Then I can see another question from asking if we support personal students projects. So I think it depends on the type of support you are needing, and it depends on the type of project you are running. Probably you could provide us more details on that. We would know how to come in to support. We may not provide any direct support, but we could still nudge you to persons who can support you. So I think it would be great you send OptoGlobe an email. Our email address is also in the chat, or you just probably send me an email as well to my personal mailbox. I would send that in the chat as well. So I hope there are no other questions that I have not. Thank you.
Thank you so much. Thank you so much, Femiche, for your input on all those questions. So we are going to the next thing, which are the breakout rooms. You're going to receive a notification on your screen that will take you to the different rooms. Yeah, in those different rooms, we shall be in very few groups, and I hope you connect to each one of them.
Probably let's have further discussions on that, because these are very big issues. Somebody raised a suggestion or a challenge rather in their school where their lecturers are not enough. You have one lecturer teaching up to over 4 courses, and then they do not know what they are even learning. They do not have access to certain materials. And of course, I think somebody's volunteered to send some textbook links. So I think if you were that person, you could send it to enquiries@optoglobe.org, and the person who requested, you could reach out to us via email, so we share it. So I don't know if somebody was speaking earlier in my own breakout room. I do not know if the person would love to, or if there is any other person who would just love to also continue speaking here just before we move on with the rest of the program. Thank you.
Thank you. I had volunteered to send the link for the learning material. Just the other question I was asking was about what do these people who study 5 years actually do that is different from us? Because some of us, we are doing the course for 4 years. So is it okay if you can share with us the course outline so that we can integrate some of the things that we are missing out? We want to be as competent as any other African. So I don't know if it's okay.
Okay, Given, please go ahead.
Okay, I wanted to add on the Brian Holden Learning Institute resources. To the one who needed the notes or rather the links, I think it could be easier when he or she accesses it through the browser. Like when you try typing Brian Holden Learning Institute, when you click on the page, there'll be, I think it is a bolded part on the learning resources where once you click, you can get the learning resources for any unit, any course that you are interested in. I think that could be somehow easier on those who are complaining about the learning resources. Otherwise, thank you. But then I had another view about, like, to see, once we are coming up with a new student association of optometry in a school or rather in a country, we come up, let's say we come from a 0 point where we are the ones who we have to formulate everything, come up with the associations, and yet arranging for the association staff is somehow a hectic job. So I think in the challenges that we pass through, the best thing to put forward is just consistency and networking. I think that could be better. But then I thank the bodies, the OPTOGLOBE, EFOS, the VOSH, for the international networking among students and those who are in the fields. Otherwise, thank you.
Thank you very much, Given. Thank you very much, Ngaji, and everyone who spoke earlier. Sorry, I couldn't pronounce the name properly. I think a question came up earlier, and the person was asking about the difference between we who study optometry for maybe 6 years and those who study for 4 or 5 years. I think I would just, from my own perspective, I really do not know what the curriculum may be in every other school, but from my own university here in Nigeria, I would try as much as possible in a very short time to simplify what our curriculum looks like. So your first year in optometry school here, you do general, basic, or will I say advanced level physics, chemistry, or inorganic, organic, uh, mathematics, animal and environmental biology, and plant botany, and some other essential social or economical courses like GST. And in your second year, you get introduced into geometrical optics, physiological optics, you do general medical courses alongside medicine students, dentistry, pharmacy, anatomy. So you get to hold classes with those guys. And of course, it may get really stressful in second year because we have to do, a large number of physiology subsections, in 1 year, and sometimes it gets overwhelming. I can remember when I was in second year, I was reading like my life depended on it. I mean, my life depended on it. So in your third year, you advance. I think that's when you break off from what other people are doing and you just focus more on optometry. you still do some form of research courses. When I mean courses that have to do with research, like biometry, genetics. So you just have to do those courses as well. And you further move into optometry. In your fourth year, you begin your clinicals. So I think this is where there may be some difference now. In some places, I do not think they really go deep into clinical education. Even if they do, because of the scope of practice in that country, they are restricted to maybe just refraction or maybe just lens prescription, and not really maybe going into pathology and what we have to, you know, what we have to do in these parts of uh, the world where we have 6-year curriculum. So in your 5th year, you begin externship program in the 2nd year. I think not many schools even do that, across Africa. An externship program is where you leave school and go to a clinic, more like a placement, and you actually like work real life experience in the clinic. You see how the clinic looks like, and you just work there for, I think, probably 3 months, 1 month to 3 months, and in your 6th year, you continue with clinical practice. So you go deeper, you get more involved in clinic activities in the schools, teaching, hospital, you do your project as well. And of course, you continue with other optometry courses. So it's I do not know how it is, or if it's the same, probably compressed in 4 years for other people, but I just tried my best to summarize it. I don't know if there is any other person who has another idea of what it's like in their school and would love to share. I can see in the chat, is the head and neck course compulsory for optometry students? Anatomy sometimes can be, quite challenging for students, anatomy and physiology, having to study some certain parts of it. And sometimes it just looks like, do we really need to do this thing? But I think when you go further, you begin to appreciate, when you're studying some certain things, studying about the cranial nerves, you begin to appreciate the knowledge you gained from those courses. At some point when I was doing, for example, when I was doing genetics and biometry in my, I think, 2nd and 3rd year in optometry school, I questioned it. I asked, why is this important? But today, when I decide I'm on certain research teams, and I see the importance of what we learned then, even though we never valued it then, but just cramming. We crammed then, we saw it as not important, so we just crammed, but now I have to go back to those notes sometimes to read them just to have an idea of what we're doing. So everything, no knowledge is useless. Every knowledge is needed. And I think even if it may not be compulsory, I think it's very important that an optometry student should, have that knowledge. So I don't know if there are any other contributions from the other breakout rooms. So we could, because I see so many suggestions as well on where you can get. So for the person who asked about getting sources and books, you can tap on those links. And I hope maybe very soon your school is able. I understand the issue for lecturers. There's actually a brain drain, especially in this part of the world where everybody is, looking on the search for greener pastures, and nobody really wants to commit to academics because probably there's no much profit in it. There's little pay. So everybody also wants to, own a private practice or do clinical practice rather than come teach and then take home peanuts that can barely even, transport you to work and back at the end of the month. So it's something that's quite challenging. And then I think that's what's really affected our academic institutions in this part of the world. And unfortunately, hiring of lecturers is not something the departments can do independently, or the faculty can do independently. Like, for example, in my school, the federal government of Nigeria actually has through the University of Benin being a federal university, to put out, a notice for employment. So without these things happening, I think it's not possible, that more lecturers can come. So I think we just have to keep on doing more advocacy, taking these challenges to the council, to the Ministry of Health, Ministry of Education, as a student, as student associations, you liaise with your school heads and, just to hope for the best. So I think, I do not know if there are any other contributions. Thank you. In the case that there is none, Blessing Samson, please go ahead with the program.
All right, Tamike, thank you very, very much for that wonderful summary. I think you touched every aspect. And one thing I will say is that even from my own section of the breakout room, I think both the challenges you mentioned was also similar to that we experienced in our own breakout session. So I discovered that this is something that from this part of the world we're having a similar challenges. So this is a call for everybody to actually put in every effort they can in order to advocate that optometry is actually better, is much more better. So the mission and the vision has to be held by heart to ensure that at the end of the day, the goals we're actually working towards is achieved. So I want to really appreciate each and every one of us for staying down to this point in the meeting. And I'll be calling on Pemije once again, the founder of OPTOGLOBE, to give us his vote of thanks. So Pemije, the platform is yours. Thank you very much.
Thank you very much, Samson. I just want to be brief in thanking everyone who joined us, and of course, thanking every student association who has worked with us towards the success of this summit. Today is the final day, and I mean it's been a long stretch of 4 days and a very successful one at that. I would love to first of all thank SVOSH Manila Central University for co-hosting this with us. It's been, I think, 8 months since we started this whole discussion, and having countless meetings with Dr. Jennifer Lynn Vinola and team, and of course we are having it. It's a reality today. I want to thank our moderators for today's session, my president at the Nigerian Optometric Student Association, Samson Alozie, and of course as well blessing from the Makerere University Optometric Student Association, who is also their deputy speaker. Thank you very much. You guys did a wonderful job today. And of course, I would love to thank the SVOSH University of the Free States chapter, who was summit partner, Makerere University Optometric Student Association, another summit partner from Africa, the Nigerian Optometric Student Association, another summit partner from Africa,
So I think Pemije is having a bit of network issue. So I would also love to call on.
Yeah, okay.
Okay, he's back. He's back. All right, Pemije, the platform is
All right,
yours.
thank you very much. My PC actually went off. We had a power cut. So thank you very much. I'm back. So I would just love to thank all our summit partners, the National Optometric Student Association, Western UCO chapter, Opto Bharat from India, SVOSH UFS South Africa, Oman Optometry Club, the Middle East in Oman, Odis Future in Saudi Arabia, Sudanese Optometric Society in Sudan, OSA NNU in Palestine, Junior IPAO MCU chapter in the Philippines, Makerere University of Optometry Student Association, MOSA in Uganda, Nigerian Optometric Student Association, NUSA in Nigeria, Know the Globe Manila Central University chapter in the Philippines, and the Pakistan Optometric Society in Pakistan. So, I mean, we've been able to pull this through. I would love to thank all our speakers for today, Apelele, Henry, Luke, a regional director from Australia, Don Mark, a regional director for Africa, the immediate past president of the World Council of Optometry, Professor Peter Endicott, Onake Ojo, who gave us a wonderful and insightful presentation, Manpreet Kaur, who is the education officer at the University of Melbourne Optometry Student Society in Australia. We had a wonderful event today, I must say, and I look forward to what we can pull off next year. I would love to thank, of course, everyone who worked behind the team, the organizing committee led by Jimin Josephine, every other person here today, Julius Nyerere, Angela Roye, I am just trying to look through. I would also love to thank Adetono Adeboye, our Director of Public Advocacy and Engagement. Probably if you're on the committee or on the team and I've not called your name, you could just drop it in chat. I'd love to thank Ikra Salam, our Director of Digital Strategy. I would love to, there are a lot of people I would love to appreciate today, and who have put in a whole lot of work towards the success of this summit. And at this point, I think I would be handing over the mic to Madam Maria Arce Morera, who is the Executive Director of Watch International. And I think without her support, this would not be a reality last year and even this year. So please, Ma, I think you can have the floor now. Thank you, Ma.
Thank you, Pemiche. Thank you very much. It's been a long 4 days, but very fruitful, and I'm very thankful for the partnership. It's been a lot of work for all of you, but it's really nice to see the collaboration between Philippines and OptoGlobe this time. We are definitely sure this will continue happening in the future. So just few words of advice perhaps, or reflection from my side. One is that we don't need to reinvent the wheel, right? We all have limited resources and limited time. You are students, you have to obviously do your studies and your practical things. On our side, we are small and enthusiastic as you do, but I think there is the potential for perhaps trying to do too much at the same time. So let's try to focus. Let's be practical, but also be strategic. It's important that we, make that we have clarity on which are the steps we want to follow to ensure success. There are different initiatives that we have that could be helpful. It's been good to hear, some of the challenges that you have identified. And I believe that in the next months and weeks, we will be able to discuss internally and also with you how best to communicate what we have and how to improve what we have. Because the value of this discussion is that we are among the students, and students have a very different experience of what is to be where you are, and what you would like to see in terms of your learning experience, but also your future as professionals in your country. There are many points of common, as I said. There is lots of enthusiasm from our side as well. We have plenty of volunteers who are really willing to help. And I think there is a potential to match our volunteers with your schools and your enthusiasm to make a difference. I want to appreciate my colleagues, Dr. Vignola and Dr. McAllister, who have been here with us. And I would like to ask perhaps a few words from Dr. McAllister. He is the co-chair of the committee that works with the relations of our SVOS chapters. So Howard, perhaps you can share some words of wisdom with us. Thank you.
Well, it's been a long 4 days, but I've enjoyed it, and it's been nice to hear your concerns. They're really not dramatically different from concerns of U.S. students, but it will help us do a better job knowing what you think, and we certainly look forward to working with you in the future.
Thank you. And Jennifer, if you're available, perhaps you could also say some words on behalf of Bosch International as a board member. Dr. Jen was traveling, so perhaps she's not able to connect. Okay. So anyway, thank you so much. I feel invigorated with your enthusiasm, but I think we all need to rest now. So we'll be hopefully seeing each other next year as a group and with more things to report and ideas implemented. So thank you, Pemije, thank you, OptoGlobe, thank you, Jen, and thank you all the students who took the time to participate, to learn, to listen, and to show us what is possible.
Thank you, everyone. Goodbye. Good night.
Goodbye. Goodbye.
Bye.
Good night, everybody. See you soon, inshallah.
Goodbye.
Goodbye.
Inshallah.
Take care.
Thank you. Thank you.
Bye. Bye.
Bye.
Goodbye.
Take
Good
care.
to see you all. Bye.
Goodbye. Thank you.
Bye. Thank
Thank
you.
you so much.
Good night, everyone. Till we meet next time.
Yes.
Au revoir. À la prochaine.
Au revoir.
Merci. À la prochaine.
Merci.
Say ciao em português, too.
Oh, tchau em português também.
Obrigado.
Não, obrigada a
Obrigado.
vocês. Obrigada a vocês.
Obrigado.